Mechanical lifts help make care easier on the client and less physically stressful for staff, thereby decreasing injuries that can result from transfers. The VANDER-LIFT 2 can be used to transfer clients who require high levels of care. Refer to the operation manual for client selection criteria. The VANDER 2 may be used to transfer clients who weigh up to 450 pounds. Clients who have injuries or medical conditions that could be aggravated by the lifting procedure may not be lifted or transferred with the VANDER-LIFT 2. This video should be used along with the VANDER-LIFT 2 operation manual and hands-on training led by a manufacturer's representative or by your facility's mechanical lift trainer as part of a mechanical lift education program. The video is divided into different modules. Practice the procedures demonstrated in each module with staff members until you are comfortable and confident with your ability to operate the VANDER 2 safely before using it to transfer clients. Only staff members who have been trained according to the procedures in this video by a manufacturer's representative or by your facility's mechanical lift trainer may use the VANDER-LIFT 2. The VANDER 2 is equipped with rear caster brakes. The brake should only be used when operating the lift on a ramp or an incline. To lock the brakes, press on the back of the brake tab. To release the brakes, press on the button on top of the brake as shown. The base of the VANDER 2 should be open to its widest position for all transfers. The base may be narrowed to go through doorways, but must be opened after the lift has cleared the door. To adjust the width of the base, stand behind the lift, grasp the soft rubber handle on the shift bar, and move the shift bar as shown. The pendant switch is used to raise and lower the lift. To raise the VANDER 2, press on the up arrow. To lower the lift, press on the down arrow. The pendant switch attaches to the lift with a magnetic base. The magnetic base allows you to move the pendant switch to any metal surface on the lift. Battery indicator lights are located on the back of the battery control pack and on the back of the wall-mounted charging station. The green full light will shine when the battery is completely charged. When approximately 80% of the battery's charge has been used, the orange charge light will shine. It is important that staff recharge the battery when this light is on. There are two ways to recharge the VANDER 2 battery. If your facility purchased the VANDER 2 with the recharging adapter, plug the adapter prongs into a standard 120-volt AC outlet. Remove the white plastic tab that covers the adapter hole on the bottom of the battery control pack and insert the adapter plug. If the facility purchased the VANDER 2 with the wall-mounted charging station and an extra battery, remove the battery from the lift by pulling up on the battery handle firmly. Line the round pins on the back of the battery with the rectangular holes on the wall-mounted charging station. Align the two holes on the bottom of the battery with the two-prong receptacle on the base of the charging station. Gently push the battery onto the charging station until the orange charge light shines. This indicates that the battery is charging. Refer to the operator's manual for further information. If the pendant switch fails during a transfer, press on the yellow emergency lowering switch located on the bottom of the battery control pack to lower the client. This switch will not lower the client if the hand control is still working. In the unlikely event that the pendant switch fails at the same time the emergency lowering switch fails, a red emergency lowering clamp is located on top of the actuator. Pull the end of the red clamp and turn the actuator shaft clockwise to lower the patient. See the directions on the actuator shaft. A red emergency stop knob is located on the back of the battery control pack. If the hand control fails and the lift continues to raise or lower, push in on the emergency stop knob to stop the lift. When the problem has been corrected, turn the emergency stop knob clockwise to the right and the lift will operate again. Before transferring a client, it is important to check the sling for signs of damage, for loose and missing stitching, and for tears and excessive wear that might cause it to fail. Be sure to inspect the stitching that attaches the loops to the sling. Damaged or overly worn slings must not be used, as their use can result in injuries to the client or staff. These are examples of the types of damage to look for. It is also important to inspect the lift before transferring a client to make certain no parts are missing or excessively worn and that the lift operates freely. Make sure all nuts and bolts are present, that the lift arm hooks are not worn, that the shift bar opens and closes the base of the lift properly, and that the brakes hold the lift securely. If a problem is noted, the lift should not be used until repairs have been made by qualified maintenance staff. VanCare slings come in a variety of styles and sizes. The standard Unifit sling will be used in the demonstrations. When transferring a client using the Unifit sling, the sling should be long enough to fit from the client's coccyx to the top of the client's head, or a few inches above the top of the client's head. The sling should be wide enough for fabric to extend at least 2 inches in front of the client's anterior shoulder. When the correct size sling has been determined, the information should be documented on the client's care plan, and the information should be communicated to the nursing staff. Using a sling that is too small or too large may result in injury to the client. It is important for staff to use the correct size sling when transferring clients. Refer to the VANDER-LIFT operation manual or contact your distributor for information about sizes, fabrics, and types of slings that are available. 2 methods can be used to position the leg supports. Refer to the VANDER-LIFT operation manual or contact your distributor for client selection criteria for each of the methods. Position the leg supports by lifting the client's legs one at a time and pulling the leg supports under each leg, being sure not to twist or fold the leg supports. Cross the leg loops for one leg support through the leg loop closest to the leg support on the other side of the sling. Position the leg supports by crossing each leg support under both of the client's legs, being sure not to twist or fold the leg supports. It is important for staff to attach the sling loops to the hanger bar hooks with the loops in the bottom of the hooks, as shown here. If staff do not connect the loops to the hooks correctly, injuries can result to the client or staff. It is important for staff to double-check the loop attachment to the lift before every transfer. This shows the sling loop incorrectly positioned on top of the hook guard rather than in the bottom of the hanger bar hook. This shows the sling loop caught on the end of the hook guard rather than in the bottom of the hanger bar hook. The crossed loop method of positioning the leg supports will be shown in this demonstration. Before transferring the client, check the care plan to find out how many staff members are required, which size sling, and which method of connecting the sling to the hanger bars is to be used. Inspect the Vander-2 and sling to make sure they are undamaged and in good working order. Explain the procedure to the client and have the client turn to the side, helping as needed. Position the sling under the client with the colored handles on the outside of the sling. Place the leg supports under the client's legs, being sure not to twist or fold the leg supports. Open the base of the lift to its widest position and move the lift into position with the hanger bar assembly above the client's stomach. Connect the sling loops to the hanger bar hooks to transfer the client in the desired sitting, half-sitting, or lying position. The sitting position is shown here, with the shoulder loops connected to the hanger bar hooks in the loop closest to the sling and the leg loops in the farthest loop from the sling. Double-check the sling connection to the lift. Leaving the brakes unlocked, lift the client about 2 inches off of the bed. Back the client away from the bed and lower the client so his or her feet are at the top of the base of the lift. Slowly turning the lift, move the client over the wheelchair until the client's buttocks are against the backrest, adjusting the angle of the wheelchair slightly if needed. Lower the client until the shoulder and leg loops are loose. Unhook the sling loops from the hanger bar hooks. Back the lift away from the wheelchair and remove the sling. The crossed leg support method of positioning the leg supports will be shown in this demonstration. Before transferring the client, check the care plan to find out how many staff members are required, which size sling, and which method of connecting the sling to the hanger bars is to be used. Inspect the Vander-2